Hello and welcome to the Holistic Nurse Academy podcast, where we are bridging Eastern and Western medicine and embracing all things that have to do with holistic nursing, which includes being an option giver. I'm Holly Taylor. I am a board certified nurse and not board certified nurse, a board certified holistic nurse and a registered nurse of 15 years. Um, and it's just my goal and hope in this podcast that we will give nurses options, give patients options when we hit a point where we need some more knowledge, information along our health journey. Today we have Rachel Montero with us. She's a nurse practitioner and functional medicine practitioner. Is that right, Rachel? Okay.
Yes.
And I'm excited. I always love it talking to my fellow nurses and talking about our journeys, how we got here. So thank you for being here today.
Thank you so much. So grateful to be here.
Yeah. So one of the things that I'm holding this platform for is in hopes that other nurses can find themselves in this conversation. Like the other day, you and I are on a similar, it's called Nurses Elevating Nurses Facebook page.
Hmm.
And somebody just posted who was a nurse practitioner. She said, I was a nurse until COVID, and COVID burned me out. And
Hmm.
now I can't even think about going back. But now what do I do, right?
Hmm.
So I want this platform to be kind of the conversation filler for those, one of the purposes is to be a conversation filler for that and maybe give them some ideas on what they can do next without having to throw away. We were just talking before we started about how you got your nurse practitioner degree and how hard that is,
Yes. Yeah,
right?
very much.
And just getting your registered nurse degree, becoming a nurse is really hard. So to
Mhm.
find the emotional reserves to keep going, props to you. So, what was that journey? Let's talk about you. Let's talk about how you became a nurse, like what motivated you to do that, and then how you found the fortitude to keep going and become a nurse practitioner.
Yes, it's been quite the journey. It's really interesting to reflect back on. And as far as jumping into nursing, it's funny. So I never thought I would be a nurse. I knew that I wanted to do something with people in some capacity. And I grew up in a home where my older sister, became a nurse ahead of me. And I'm like, I want to do everything but become a nurse, right? And then it's funny how that happens, where you jump into different experiences and also experiences in life that you go through, and they start to shape you and start to plant seeds. And I had gone through various scenarios. One in particular that was very meaningful was my grandmother, who had a stroke, and she passed away shortly after having a stroke. And I remember that planted a seed in me. I was pretty young at the time. I was roughly maybe 10, 11-ish. And I remember thinking at that time, like, could this have been prevented? Like, that seed was already starting to plant. And also witnessing the care that was given to her alongside um, my grandpa down the road. And things continued to happen where I just felt that pull to support people in healthcare in some capacity. And I then eventually shadowed different healthcare professionals. And once I shadowed with a nurse in a pediatric unit, I just connected so deeply with her and the work that she was doing. And it sparked the desire to apply for nursing school. And once I got in, I was accepted, and everything continued lining up to go in that direction against what I thought the path I was going to go. So, push through nursing school. Certainly, as we all know, it is very difficult, very challenging, very stressful,
Yeah.
but we have a heart to help people. So, that helps us to continue moving forward. And when I finished nursing school, I jumped right into med surge on a busy unit, and was working crazy shifts and just did what I thought I was supposed to do. And it was a really great opportunity to be challenged, to be pushed out of my comfort zone, to be pushed as an RN much sooner than I thought I would. I went right after high school, jumped right in, and then I feel like this is also coming back to, honestly, it was God that gave me the strength and the ability to do this because I definitely could not have done that without him. And I know that he placed me there for a reason. But while I was there, I still also felt like there was so much that was missing in our care. There were a lot of gaps in how we were supporting our clients, our patients, how we were educating them, the rushed patient care, the pushing the medications, continuing to see the same patients over and over again. And I'm just thinking, why is it this way? I thought that we would help people heal, not continue to come back to the
Right.
hospital or continue to develop more chronic illnesses and comorbidities. So then I thought, well, maybe I just need to continue with school, went on for my bachelor's, and then follow the path of nurse practitioner, thinking that that would allow me to help people heal in a different way. And also, some people that I looked up to were pursuing NP school. So I wanted to follow that path as I really respected and looked up to those nurses. And they encouraged me to take that step. And all along, I was navigating my own health challenges that were left un I guess you could say difficult to navigate, but also hidden in the sense of I just felt like I had to push through. I was exhausted, dealing with gut issues, terrible stomach pain, acne breakouts, even though I thought I was doing all of the right things for my health. And there's a lot of shame as a nurse thinking that I shouldn't be struggling with health issues. I should know better as a nurse. So I secretly dealt with that for many years. And that pushed me where I reached a breaking point of I need to do something different because I was having normal lab results. I was healthy on paper. I looked healthy, but in reality, I was really struggling internally. And I came across a functional medicine specialist on Instagram, and her content really spoke to me. I felt like I could feel really seen and supported by her and what she was sharing. And I decided to take the step and decided to invest in more holistic care for myself. And this is where I started to recognize for my own health, but also what I witnessed in healthcare, the gap that I feel like I was noticing all along.
Yeah.
And everything started to come together where I started to experience relief from my own health and my own symptoms, and also started to understand health from a new lens and not this blanket approach or this quick fix approach, but rather understanding the body as a whole, understanding how our systems are so interconnected, going deeper than here's a medication, but rather what's underneath the surface here, what's really at the root of these symptoms, what is the message behind that? And that continued to compound where that's where I knew this is where my nursing career was headed, but I had no idea what that would look like. So that compounded into a whole new direction, but that's a snapshot of that journey.
Yeah. Well, and what is the journey? Oh, is this like 10 years? Is this longer?
Yes, so it was about 8 years as an RN, and then I was finishing my NP school, my NP degree at this time. And I'd been in the hospital working while continuing with school. And I remember at this point, I had done a lot of different fields in the hospital. I was on different units. I did the float pool, I did med surg, surgical, um, pre-op, you name it. And I kept thinking, well, maybe the next unit will kind of like
Yeah.
curb what I felt like was missing, but it just kept widening that gap.
Yeah.
And then in NP school, I remember thinking in clinical, I'm like, man, I just feel like we are still just pushing medications and we're very rushed with our patients. We're still basically telling them, well, here's a pill you can take. Here's a very short diet plan you can follow if we even have the time for that, and send them off, and that's it, and move on to the next patient. And I felt very frustrated by that. And I felt like I was still doing them a disservice. So I was wondering, what can this look like? How can I still help people more holistically with my nursing degree? And I decided to pursue travel nursing at this time in my life while figuring things out. And I remember this was during COVID. I had just moved to North Carolina from New York. I moved there solo, and I ended up getting sick with COVID. So I was at home And I remember sitting in the kitchen, I'm like, man, I just feel this tug on my heart to do things differently. And I was doing more research, searching holistic care, functional medicine, holistic nursing, looking for jobs. And nothing was really coming up, or I needed years of experience in functional medicine to be able to meet the job requirements, which I had not. So then I came across a nurse practitioner online who started her own functional medicine practice. And that helped me to see a new path that was more in alignment with where I wanted to go. But
Yeah.
then the fear came up of, who am I to start a business? I had no experience as an entrepreneur. I
Yeah.
had no background. No one in my family had a business background, so it was very foreign to me. But I still kept feeling that tug of taking that step into it and starting to view nursing from a different lens in terms of, maybe I'm not meant to stay in the hospital or in a primary care setting. Maybe I'm meant to go beyond those walls to help people differently.
Yeah. Love that. So, how did you get? I think one of the questions that I know nurses have when they are kind of where you were at, where you're kind of at that fork in the road and this isn't working for me anymore. So I'm ready to take a step in a different direction, but I don't want to. I went to school for 4, 8, 10 years, whatever X is, and I don't want to just throw that away. How did you find the education you needed to do the functional part of nursing?
Yes. So I ended up, this was more so for my own health journey. I just wanted to continue optimizing and learning more. So I did a functional nutrition program and I loved it. And I felt really excited to learn and study because it was actually understanding the body from a new lens versus the quick fix approach or the separate systems that were taught in nursing school. And I began to apply it more personally, honing in more so on, how do I navigate stress in my life? How do I navigate and support and nourish my body with more wholesome foods? How do I create more balance in my life with my lifestyle and breaking free from that hustle, go, go, go mentality? How do I set boundaries in my life, right? All of these things that we are typically not taught. And then after that was completed, I had a lot of insight in functional nutrition and more of that holistic lens, but I didn't know how to best apply it to support other
Yeah,
people outside of myself.
right.
So I then continued to do more research and I came across a couple of people that were already running successful practices in the holistic space. I reached out to them. I asked them what they had been doing. They gave some great insight and encouragement. And then I started to learn more in business and how to actually set up a business because I felt like at this point I wasn't able to find what I wanted to do through a typical job. I needed to branch out and start my own thing. And so I began more diving into setting up an LLC, what this could look like, legality wise as an RN and an NP, how to support clients. And I began to learn that I could still utilize my nursing background. And even though I wouldn't necessarily be utilizing my license directly with this care, that
Yes.
background was still coming with me. The foundations, everything I've learned, I was
Mm-hmm.
just translating that over into the care I was providing and bringing in that credibility that I had as a nurse, as an NP, to build more trust with clients and support them, but then branch and fill the gap of, here's how we're branding it in a more holistic lens in this regard. So I continued to gain more confidence and hope that this could be possible. And then I worked with a mentor. She was a functional medicine practitioner, former naturopathic doctor, and she really helped me to dive deeper into how to actually apply functional medicine, how to take that knowledge and translate it into patient care and building out an offer to support people differently in this space.
Yeah. Um, so it sounds a lot like a bit like my journey on how I became board certified as a holistic nurse. It was a journey, right? It's like there
Mhm.
was no clear path. Did you feel like there was no clear path and you're kind of paving the way? And yeah.
Exactly.
So, my understanding with functional medicine is it's root cause type of care,
Mhm.
right?
Yes.
How you would describe it?
Yes, and I think so it's interesting. I feel that there are some aspects that I've been learning now in functional medicine where I feel like some of it has, in a way, taken on what Western medicine does in terms of the here's a medication for this diagnosis, right? And I've noticed, and this is a big gap that I've seen in women who have come to me who have worked with a functional medicine specialist, where they were told, here's a supplement protocol and a diet plan, but that still missed the mark in terms of looking at the whole picture. So I feel like what I'm learning with functional medicine is I feel like sometimes it's still a little broken in the sense of we're not always looking at the whole picture or the true root cause. Sometimes we're still bringing in that quick fix approach
Yeah.
with a supplement instead of a medication. So that's where I'm really cautious around language, where I want to be intentional in terms of it's really meant to look at the whole person and look at all factors impacting their health and how their systems are interconnected and working as a team, and what's the message beneath the symptom to support
Yeah.
that more
I
so.
love that. No, I really, really love that because I agree. You know,
Mhm.
we hear I'm on my wheels are churning here as we're talking, so hopefully I can get all my thoughts out. But the conversations I'm hearing, um, and you know, you have to take it all with a little bit of a grain of salt because
Mhm.
it's social media influence. There's um, influencers. There's actual people who are in the hands-on boots on the ground nursing. So we have to kind of take all of this and not overcommit to one thing. But
Mhm.
what I'm hearing is some deconstruction from the traditional, nursing school, NP school. There's some of this. We were taught one way. It's the scientific process, outcome based. So there is like research behind it, outcome based, and then the pharmacology of it all on top of that. And then there's the other aspect where there's these nutritional supplements, which people swear by help. And then we're being told, well, there's no research behind that. They're not FDA approved. They haven't gone through whatever X's in order to make sure that they can be prescribed or taken appropriately. Or even just as a nurse, we know like we don't always need a supplement for everything because our body produces the thing you already need. So, like, let's dive into that a little bit more because I'm open minded. Like, treat me like I'm a 5-year old and I'm learning all of this as new, but I'm open to the conversation evolving where we're bringing in some, like, I just truly believe in balance.
Mhm.
I truly believe in not being extreme
Yeah.
on how we believe and think and act and do because A, that just causes anxiety and stress in our lives,
Mhm.
and B, it's just not objective and grounded. And so my goal is to be objective and grounded. So
Yeah.
even I've had to change as a person to not be so extreme in my thinking, be a little bit more curious about life, right?
Mhm.
Not
Yes.
just medicine, but life. So
Yeah.
bringing that into the conversation we're having, what are your thoughts of what I just said?
Yes, I love that you bring in this perspective, and I completely agree that it is certainly having to break away from the norm or maybe what we've been taught and be more open to
Yeah,
other possibilities.
yeah,
And I feel that we live in a society with a lot of broken systems. Our healthcare system is quite broken.
yeah,
And I feel that we have to recognize that there's a lot going on behind the scenes that's pushing certain
yeah. Button.
approaches.
Yeah,
Exactly. And it's been ingrained in us many times for years.
yeah,
And we have to recognize sometimes these beliefs that we have, maybe they weren't even ours to begin with, but they've been ingrained in us
yeah,
from other people, what we're exposed to, what we're told, what we're taught. And as nurses trained in the traditional realm, that's our norm. That's the language we learned. And it did take a lot of, I would say, willingness and openness to be more explorative, like you said, to be more open and to be willing to say, you know what, this may be different than what I was taught, but that's okay. What if there's a new way that we can look at this to be able to support people more effectively? and
Yeah.
to really meet people where they are. And I think that a lot of times as nurses, we truly care about helping people on their health journeys and wanting them to be the most successful in that. And when we are in a healthcare system where certain things are being pushed and there's a lot of pressure on us to follow these protocols, to meet these expectations, to check off the to-do list, right? And we're also taught we need approval. We need approval. We need the signature from the doctor in order to do this. We're questioned sometimes. There's pushback when we try to speak up. And we have to be willing to say, you know what? I am not going to follow this, what has become normal, and be more open to, you know what, I do have a voice here. I do have a say here. And maybe what I've been thinking all along hasn't been in alignment with what I truly want in terms of how I want to help people or what I believe may be a better way to help people.
Yeah.
And I think with this was definitely a learning process and being open to having a different opinion and people not agreeing and people questioning or people wondering. And this is completely normal when you are going against the beaten path and stepping into something that's still being explored, that's still being brought to awareness. And I think more people now are being more open to holistic care and functional medicine because we're seeing the gaps, we're
Yes.
experiencing the brokenness of our healthcare system. And people are tired of being dismissed and tired of not getting the full answer and not getting proper solutions for their health journey. So I think that also in this is that I had to remember that it's okay to kind of put my guard down and say that maybe I'm not here to quote unquote fix a broken system, but I can step out of it in order to help people differently and bring a new lens, bring a new perspective to their health journey that they haven't had before.
Yeah. I agree. So that's kind of how I felt.
Yeah.
I'm not, um, I didn't see a way to change it within, so I kind of stepped out. And I'm
Hmm.
trying to kind of like on the side door here, trying
Yes.
to, find some balance and all that. But
Yeah.
so thank you for articulating that so well. So let's talk about gut health and I mean that seems to be your niche. Is that right? Are you still working and focus on gut health?
It has been gut health,
Okay.
yes. I will say within that, though, I have been connecting more deeply with women who they've been caring for others. Many times they're healthcare professionals, nurses, and they've been dedicating their lives caring for others, and they've been setting their own needs aside. And as a result, their health is being sacrificed. So
Yes.
that can definitely translate into gut issues as well as hormone issues, fatigue, exhaustion, brain fog, bloating, etc. So I would say gut health, yes, but now it's turning more into helping the women who has been setting themselves aside allow themselves to care for them too.
So yeah, walk us through kind of how you work, what your protocols are, maybe what you've seen that is helpful. What are your success stories? All the things that you're doing.
Yes, so I have been working and I work solely virtually with clients and I'm able to work with women throughout the US, which is a huge blessing.
Yeah.
And this has allowed me to be able to reach women that I otherwise likely would never have been able to meet or support. And I've been utilizing social media primarily to connect with women and market my services. And I have been focusing on it's a comprehensive high touch program called Becoming You Again. And it's a blend. I have a co-practitioner as well. We're working together. So we blend in nervous system support with more holistic nutrition, more lifestyle mindset, um, support paired with deeper functional lab testing to really look at the body, understand what imbalances are at play, understand what's seeking support, while also looking at the person, their life, their day to day, their stressors, their routines, and what's impacting them, even looking back to childhood. And I think that's where it has been a really beautiful opportunity to have the time and space to actually get to know the person, the human. And many times I become close friends with my clients because we get really close and we spend a lot of time together. And I dig into so many aspects of their journey. Typically, it's step by step, it's not all at once, but it's a gradual process of uncovering the missing pieces that haven't been brought to awareness before. Maybe it's, for example, someone who has been navigating the go, go, go hustle mentality. And as a result, that's been placing a lot of stress on their gut and their hormones, and simply allowing themselves to have more permission to slow down, to walk outside in the morning and get some sunlight, to actually set aside time and prep a gentle breakfast that feels really good and nourishing. So it's more of that rhythmic focus, I'd say, and also that permission base in terms of allowing themselves to take the time to
Yeah.
nourish their body in the way that their body's asking.
Yeah. I love that. I love those, I would call them Instagram reels right now that I'm seeing where people are demonstrating, like teaching my nervous system that not everything's an emergency. Have you seen those?
Oh, yes,
Rush,
yes,
take a deep breath and they start to walk slower. And
yes.
yeah, I think we do run our lives as if everything's a go, 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 rush, rush, rush. Everything's an emergency, so to speak, when it's not. And
Mm-hmm.
then what does our body do in response to that, right?
Mm-hmm. Fight or flight.
Fight or
Yep.
flight. Um, all the hormones get released, cortisol spikes go up, which is a huge reason for belly fat and, just holding on to weight is a general rule, but also just feeling like totally spent and worn out.
Mm-hmm.
And nurses, as a general rule, are going to experience that every day. One of the reasons why, this is a side note, but one of the reasons why I had an epiphany working one day where I realized like I can function high. I can do multitasking like an operating system and call the pharmacy, call the DME, I'm making phone calls, I'm coordinating with the social worker, I'm coordinating with the CNA, I'm coordinating with the family, and then sometimes there's multiple family members and the patient, and I'm
Mm-hmm.
doing all these things. But what does that do? It makes the spike goes up because
Mm-hmm.
I'm like, I've got to be high adrenaline to get all that accomplished.
Mm-hmm.
And I went, one of my goals in life has been to get out of that fight or flight from just living in it as a person secondary to nursing, right? But
Yes.
um I had this epiphany. It was like, just because I can do this doesn't mean I should be doing this, because this is not how I want to live.
Mm-hmm.
Because then you have to go home and you have to recover and you have to try and re-regulate all to do it again the next day,
Yeah.
right?
Yeah.
So
Absolutely. It's a vicious cycle. Yes.
that was a very big eye-opening moment. It's like, yeah, I can do this, but this is not the way I want to feel in my body.
Mm-hmm.
And the way I'm feeling right now is telling me my nervous system is on high overload. So,
Yes.
yeah.
Yes.
Well, tell us a little bit about, like, do you have a, a story or two that just really inspires you to realize, okay, this has made a difference, this has made an impact, um, and just solidifies that, that the leap you took into functional medicine was truly what you were supposed to do.
Yes, and I'm so grateful for I have a lot of gratitude for the women that have trusted me on their journey. I don't take it lightly to be able to support them in this space, and especially many times women come to me after they've been dismissed. They've tried so many things, they've gone to their doctor,
Yeah.
and they've lost trust in healthcare, in what's possible for them. They wonder if they can actually get the relief they desire.
Mhm.
And just the fact when they say yes to me, I just celebrate that in and of itself. And I'm so grateful for that. And I want to empower them into what is possible for them and how their body is designed to heal. And I would say a couple of wins. There's, oh, I mean, there's a lot that I can think of, but a couple standing out. One is she was also a nurse practitioner, is a nurse practitioner, and she too had gone the traditional path and went to her doctor, had lab work done. She appears healthy on paper, but for years, close to a decade, she had terrible heartburn, stomach issues, nausea, difficulty enjoying food. She worked out, ate healthy, took the supplements, and nothing was truly giving her that lasting relief. And also, there was a lot of challenges with her relationship food as a result because a lot of restrictive dieting happened during that time, a lot of food fear, body shame. So, helping her to build trust with her body again, to enjoy food freely, to enjoy food with her family, to be more present, to feel more confident in her body without feeling like she needed to appear a certain way, while also experiencing relief from her symptoms and being able to live her life and show up differently for her daughter and have more joy. And also within that, recognizing that she didn't have to keep staying stuck in this battle. And I think helping her come back to her ability to support her body
Yeah.
and giving her the tools to do that um, is a huge gift because many times we can really lose touch with ourselves and lose trust in our decisions. And we think, well, I've been messing this up, or I've been failing, or I'm not doing this well, right? And remembering that it's not that you're a failure, it's just that we're often just not taught this lens, this approach, and how to tune into these messages from our body. So I think it's not just the short term, but the long term of how they can keep supporting themselves for years and years to come, and how that impacts into now how she desires to help other people as a nurse practitioner too. I think that's a big theme of what I feel really grateful for helping women too is to connect, help them connect back to themselves from a new lens, to remember what truly matters in their life, to break free from the strongholds that have been placed, they've been stuck in, and bringing them back to their values, to their faith, to being able to slow down and enjoy their life without their body holding them back and step into their calling as a result of that. And I think it's hearing from them that after feeling so stuck for so long and feeling like there wasn't a way out, for them to actually experience that way out is a huge gift. And it reminds me of when I was in the hospital and thinking, man, there has to be a better way. And I remember a nurse, I cared for a nurse as a patient. She had Crohn's disease, and she would frequently come back, and I would have her as a patient. And we just built a really beautiful relationship together. And I remember feeling so sad and just so, in a way, I felt like I did as much as I could do for her, but just feeling like I wasn't doing enough. And I feel like now I have the space to be able to give that care that I felt like was missing before.
Yeah. Well, it's interesting because I feel like I see this a lot, whether I'm the patient or a family member's the patient or, whoever X, and I'm in the room, that there is a time where people get to the professional, the practitioner gets to a point and says, I don't have anything more to offer you.
Mm-hmm.
And I'm shocked at how many people are okay with that answer.
Mm-hmm. Mm-hmm.
Because even if I don't have anything more to offer you in my skill set, there are so many more options out there than time in the day to try them out. You know what I mean? So I find that like someone like you or myself and the people I'm having conversations with, we're the ones who are like, it's not acceptable to say, I no longer know how to help you.
Mm-hmm.
Good luck. You're on your own. Like, that's not a helpful place to be. And we've got to be more creative. We've got to be more willing to, you're somebody else's problem, so to speak. That's heartbreaking to watch as a nurse.
Mm-hmm. Yes.
And I don't know. I haven't talked to many physicians about how they feel about that position and how they really put that to bed every day within themselves.
Yeah.
But if a system is telling people on a regular basis, I don't know what else to do for you, and somebody's in excruciating pain,
Hmm.
that can't be acceptable,
Yeah,
right?
really. Exactly it.
So we need to be exploring more options. Like for you, it was functional medicine. For me, it was holistic nursing.
Hmm.
Um, I do cranial therapy, a
Hmm.
hands-on modality, along with other things. But like that's the thing that I found myself passionate about.
Yeah.
But like if someone comes to me and they say, and what I'm doing isn't enough or isn't the fix, I will certainly be like, let's do some exploring, let's do some research. I know somebody who's tried this and somebody who's tried that,
Hmm.
and
Absolutely.
it's often not in the box stuff,
Yes,
right?
exactly. Exactly it. That's right. Getting outside of our rigid protocols and methods and being willing to go beyond that.
Okay, so one of the things you mentioned, and this is one of the questions I'm asking everyone that I would say everyone, but this is what I'm trying to ask is there's been trust lost. Um, how do we regain trust in the system or with our patients or, you know, or X, however you want to answer that?
I'd say it's helping them to see that there is a different approach, a different way to go about this than what has been tried before. And I also, especially, and this is where I've really enjoyed incorporating deeper lab testing, functional labs, and now we run bioenergetic scans as well, is I've never come back with a normal result. I've always come back with some sort of clarity from those results. Sometimes we may need to maybe look a little bit further into some other areas, right? But it's always given that clarity in terms of this helps us to understand a little bit more why the symptom keeps coming back, right? Or why this is maybe going on in your body. So I think that has been one aspect that's been helpful is having data that actually helps validate what they've been experiencing and give more of a why. But also, to beyond that, it's what we do with that data that matters too. So it's also having that clear roadmap, that clear process, that proven process of here's how I've supported women before in this journey. Here's how I'm going to individualize it for you. And we adapt as we go. That's where I really hone in on deeper support versus one off sessions in this space because I'm with them throughout the week. It's not just a one call once a month and I'll see you next month. It's I'm with them in their day-to-day life, can help them navigate and respond to different aspects of their life impacting them and have the tools in place as they're learning, supporting their bodies in this way. So it's also giving them that support that helps them feel confident moving forward in terms of, okay, I know I'm not alone in this. I'm not being handed this lab and sent on my way, but I'm having the guidance and there's been times where I've had to say, you know what, I need to look further in this area, or let me refer, or let me ask for example, a practitioner that I knew that I was skilled in this area, right? So it's like you said, being willing to do what we need to do to find the answer. If we don't have that solution per se, being willing to look outside the box to help them experience that alongside.
Yeah. What, um, yes, so that's how we regain trust is being willing to, let's summarize that, being willing to walk the path with them essentially,
Hmm.
even if we don't have the answers, which is kind of ties into what I said right before I asked you the question, right?
Yes, exactly it.
You said it earlier, which is meet people where they're at.
Hmm.
Learning to meet people where they're at. If people start a conversation with, I don't want another medication,
Hmm.
and you throw the idea of another medication at them, you're not meeting people where they're at,
Hmm.
right?
Yep.
So that to me is a part of meeting people where they're at. If that, listening, so it comes with intentional listening, your
Hmm.
mindful presence, actually hearing what they're saying, repeating back to them, like you said, letting them know that you have time. You're going to make the time, that this isn't a once a month follow up experience, that you're going to be in it with them. Which,
Mhm.
to that, on that note, means that we're going to be paying for it out of pocket, and that
Mhm.
that does come with additional costs, but it's worth it if we're getting. So that's part of what's broken in the system, right? Is
Exactly.
that we're told you have this amount of time with a patient and you must move on.
Mhm.
And unfortunately, until that gets fixed from insurance companies or the behind the scenes people, we have to pay and charge out of pocket for that kind of,
Mhm.
top tier service. So, with the function, one of the things I wanted to ask you, that you talked about the functional labs you draw. Can you explain a little bit what those functional labs are? Because it feels, for me, I'm a little out here with it, and I'd love to bring it a little bit more like how it applies into, like, you know, meaty, like I can get my hands on it.
Yes, that's such a great question. So, a few core ones that have been my go-tos. One is a GI map, which dives into the gut microbiome. And this one essentially gives us a blueprint of what specifically is impacting your gut. And it goes deeper than standard stool tests, blood work, etc., because we're looking at more so like the DNA of the organisms and the markers that we're assessing. So we're able to be much more proactive. And also the ranges differ. In many ranges in our traditional healthcare system, they're based off of the average sick person in the US, which is not how we want to gauge our health, right? Especially when it comes to earlier onset symptoms before it even progresses into a chronic illness. Typically, that's the gray area where many time labs are normal, but your body's communicating otherwise, that there's something off. So the GI map assessing gut health, and that one is a really great one to look for. Typically, I'll see H. pylori, even if previously they were negative for H. pylori. This test will flag it. Leaky gut is a big concern, very, very, very common that I see in many women, which can impact a multitude of symptoms, bacterial imbalances, immune health in the gut. So it really helps us to dig deeper and underneath the surface. For hormones, the Dutch test gives us a nice full picture. It's a urine and saliva sample. So we're looking at hormones throughout the day. We're looking at cortisol curves, assessing waking cortisol, evening cortisol, etc., noticing shifts, estrogen metabolism, DHEA, testosterone. We're looking beyond that micro moment in time that a blood test does, and we're looking at the patterns. So we're able to see a bigger picture of what's really going on underneath the surface. Another one that I love is the hair trace mineral analysis, that's assessing minerals, which play a big role in energy, our nervous system. They're like the spark plugs of our body. So by looking at minerals, we can really uncover a lot of sneaky causes when it comes to brain fog, fatigue, mood imbalances, anxiety as well, digestive health. And we're looking from a different lens. So we are essentially, it's kind of like when you're looking at seeing, for example, a drone shot, and we're able to see much wider versus a narrow vertical frame from our iPhone, for example. That's comparative. The functional labs are the drone, where we're able to see much wider and look at the fuller picture versus the limited iPhone vertical shot of standard testing.
Yeah. Like, are you going to immediately die labs,
Right.
yeah, or is there something dysfunctional that's causing the chronic fatigue, weakness, headache?
Exactly.
All right. Awesome. What other parts of functional medicine do you want to shout out while we're chatting today? Is there anything else that you feel like is important for? It sounds like you
Mm,
focus on women's health.
yes,
Yeah.
primarily women's health. And I would say it is, well, I think coming from a nursing background is that I carried in a lot of skills that I gained as a nurse to better support clients in this space. And many times nurses, and I had this fear too of who am I to do this? Imposter syndrome, or people will prefer a doctor instead of a nurse, even a nurse practitioner. And there's a lot of fear around stepping into functional medicine as a nurse, as well as fear in terms of our license. I will say a couple of thoughts with that, along with functional medicine in and of itself. I
Yeah.
feel way more safe providing this care than I did under my license in the hospital, caring for 6, 7 patients on a med surg floor. That was way more riskier, in my opinion, than supporting clients in the space where I have client agreements in place. I have a legal contract in place. I'm not under my license. I'm under a consultant role. So I'm educating, I'm guiding, I'm not diagnosing or treating specifically. So the language is really essential there, but we just take that, our and many times nurses, we enjoy educating, we enjoy guiding our patients. And this is what we get to do in the space is the time. We have time and freedom and flexibility to do that versus feeling forced by this rushed appointment or having to do a million other things and barely having time to really speak with our patients. I think the freedom of being able to support patients with essentially unlimited time. You can create the time that you want, that you think is best for your patient to be able to look at the whole picture. And it's the relationships that we get to build with them to help them feel seen. And many times it's such a gift to be able to support women who have been dismissed already because you're giving them the answers that they've been seeking all along, that have been missing, and that in and of itself has been healing in the fact that I actually feel validated. I don't feel like I'm crazy anymore. This makes sense. That is a huge step in their healing journey alone that this space allows.
Validation's huge.
Hmm.
Whether it's the body or the emotion,
Hmm.
the mind aspect of us, validation is huge.
Hmm.
It can just heal in a second when someone validates you. So I love that.
Yes.
Oh, sorry. Was there anything else? I don't want
No, that was it.
to. So coming from this functional medicine perspective, what are some easy things today that I myself could do or anyone listening could do to just start the journey of improving their health? Maybe like top three, top five things today.
Yes, I love that. Definitely keeping it simple and a couple of core buckets. So I would say a nervous system bucket, a nourishment bucket, and then I like to say, kind of like a childlike bucket where we're bringing back in things that we maybe have pushed aside, maybe we naturally love to do when we were younger, that as an adult we just get busy with life.
Yes.
And it's bringing that back into this journey where joy, laughter is healing too. So that can look like maybe we used to enjoy doing crafts or playing an instrument or being outside. In allowing yourself to do that again. And even if you need to schedule it in on the calendar, that's okay too, but be intentional with that piece of that and not underestimating the power of that and the impact. And then nourishment wise, it can be tuning into, well, first bring in awareness. Are there meals that are being skipped? Are you rushing through your meals? Are you forcing a meal down for 5 minutes and moving on to the next thing? But rather allowing yourself to take time to chew your food more slowly, to take some deep breaths before you start to eat, to allow yourself to be as present as you can during that meal. And that in and of itself will improve digestion, will lessen bloat, will lessen stomach discomfort afterwards, help you absorb the nutrients to get more benefit from that meal. And also being mindful of allowing yourself to take time to nourish your body and to let yourself have a breakfast in the morning, to not rush out the door with a protein bar, but even if you start off with maybe some avocado toast or some eggs and allow yourself to sit down and have that too with just more fulfilling nourishment. And then nervous system wise, this can look like really simple, gentle practices during the day. Maybe it's you can use eye movement where you're sitting down and you just utilize your eye movement to ground yourself and you look without moving your head, you look from right to left. And that also activates the vagus nerve, which is really key for the rest and digest parasympathetic state, helping your body come out of fight or flight. Or this can look like stepping outside barefoot in the summer, stepping outside to get some sunlight, being outdoors in nature, setting your phone aside, avoiding the blue light first thing or at the end of the night, little things like that can really help your body feel more safe and grounded and help your nervous system to feel more supported. When our body doesn't feel safe, it's going to be in that fight or flight survival place versus more of that healing parasympathetic state that is more ideal for our body to thrive in.
Right. Which is what I know now is that it's balance, right?
Mm-hmm.
Homeostasis is the balanced state of our body that it's always trying to achieve.
Mm-hmm.
And earlier we were talking about finding the balance in things and living, and that's kind of the state our body wants to be in too. Not just
Mm-hmm.
like not just how we think and believe in extremes or, in balance, but also how we experience life in balance will help us heal,
Yes,
right?
absolutely.
Yeah,
Yes.
I love that. Well, tell us, Rachel, how people can connect with you so they can learn from your amazingness and your skill set and do the work with you. Let's go over your ways to get a hold of you.
Yes, so primarily I'm on Instagram and Facebook for social media. So on Facebook, Rachel Montero, or Instagram, Wholeness in IN Health. I also have a separate page. I'm mentoring nurses now who desire to step into more functional medicine, holistic care at the Holistic Nurse Mentor too. So if you're interested in that, would love to connect with you.
Yeah, I was going to say that. So you do help business coach and nurse mentor nurses.
Yes,
Yeah,
yes,
I love
yes.
that. So because my understanding from our conversation is because you needed that mentor too, and it was hard to find. You had to do a lot of research, and now you can help others in that path,
Yeah.
right?
It's giving them that clear roadmap that I wish that I had back in the day.
Yes. And that's what the Holistic Nurse Academy is
Yes.
for holistic nursing. And I think all these worlds collide, right? You can be a holistic nurse, like, and a functional nurse, and all these things can come together, but they're very different paths in
Yes.
terms of how you learn and what you're going to learn. So I love that so much. Well,
Yes.
you have been amazing. I have learned so much from you, and I just love connecting with nurses who are breaking the mold,
Mm,
have the courage to do something brave, go out on their own, especially when there's the systematic part of being in the system is that there's great buy-in that comes with personal sacrifice, life sacrifice, financial sacrifice, right? And literally, we're told as nurses, don't get married, don't have a baby. Like when we're in nursing school, don't have a baby, don't get married. If you, preferably, don't have a life, like
right.
have a life
Literally.
crisis. For
Yeah.
me, the biggest drama I had in nursing school was passing kidney stones.
Mm,
But
yeah.
like, don't have any of that. I had like was passing a kidney stone on a quiz date, and I was like, I can't miss my quiz, and I literally went and took my quiz before I could go to the ER.
Oh my gosh. Yeah.
And so there's a big buy-in for us, which means it's hard to let go of the box we were put in when
Hmm.
we signed on that dotted line.
Hmm.
And so I just always, want to give praise to those who are doing it, and are giving others a way forward too. So thank you for that.
Thank you so much, Holly. I
You're
so appreciate
welcome.
you. And the work that you're doing is so needed and so
Yes. Oh,
impactful.
thank you. So again, if you want to find Rachel's information, we'll have that in the link associated with this podcast or this session. And then to find us, you will, and what we're doing with the Holistic Nurse Academy, you can go to holisticnurseacademy.org. But at the end of the day, we're building community. We want to help each other, lift each other, and be a safe place for each other. So thanks for being here, and we'll talk next time. Have a great day.